Welcome to the Introduction to HIPAA Privacy and Security training session. My name is Annie, and I will be giving you some basic information about a very important federal law that affects everyone in our company. The HIPAA law affects all providers of healthcare and most of their business partners too. At the end of this training session, you will be instructed to complete a short online questionnaire. After the training session, you will be given the names of some of the other people in our company, besides yourself, who have the responsibility to manage our compliance with this law, and more information about our HIPAA policies and procedures. I said that word so fast, you might have thought I said hippo. But no, this training session is about HIPAA. It has no big feet and no ears. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. HIPAA is a federal law that includes the rules and standards that every provider of healthcare must put into place in order to ensure the privacy and security of certain protected health information. The HIPAA privacy and security rules also apply to nearly all of the business partners or business associates that provide services to healthcare providers in various ways. There are other regulations in the HIPAA law that address what health insurance companies must do and that deal with how health benefits must be offered, but our training session will be focused only on HIPAA privacy and security rules. If you have worked in healthcare in the past, you are probably already familiar with some of the HIPAA rules, especially with the HIPAA privacy rule. Even if you are new to the healthcare world, if you were ever a patient, you were exposed to one of the requirements of the HIPAA law when your healthcare provider asked you to sign their Notice of Privacy Practices. The HIPAA privacy rule is concerned with protecting the confidentiality of data that can be used to identify a patient, such as a person's name, address, social security number, phone number, or other data that describes a person's health status. It doesn't matter if the protected health information, or PHI as it's called, is written, is in an electronic form, or is verbally expressed. What is important is that only the people who are authorized to use or receive PHI are given access to that information. The HIPAA security rule, on the other hand, provides guidance on how electronic PHI data should be secured when it is created, stored, or transmitted. Just like the privacy rule, the security rule applies to both the providers who may be creating the data as well as to their business partners who may be carrying out some of the functions for them, like managing their networks or providing billing functions. There are IT system security guidelines in the rule that determine how we manage electronic PHI data, such as requiring the company to document who is given access to certain PHI information and why their role in the company should allow them to have access to protected health information. It also requires the company to properly secure our workstations and mobile devices and any other hardware or networks that may be used to access or transmit PHI. Other requirements include the need for everyone to use strong passwords and not share them with other employees. Besides the security of electronic data, the security rule is also concerned with the physical security of people and the workplace itself. Your manager or our security officer will give you more information about the privacy and security procedures that affect your specific responsibilities. Our company has developed and implemented policies, procedures, and plans that comply with the HIPAA privacy and security rules, and that we need in order to manage our operations effectively. Most of these processes are simply good business practices, like requiring strong passwords to access the network or online applications, or having a tested disaster recovery plan to fall back on in case of an IT system failure. We routinely examine known threats that may present risks to our operations or could open the door to a breach of PHI, and we determine whether we have vulnerabilities that we must mitigate. When policies or procedures are updated or added, everyone in the organization who is impacted will be trained on how the changes affect them, because each of us plays a role in assuring the confidentiality of PHI.